Tonight on Black Health Now with Doc and Dean, we're going to give you a quick COVID update. We're going to answer why Black women with breast cancer have worse outcomes. We're going to talk about arthritis treatment right in the grocery basket. And we're going to talk about 6 things every healthy man knows. All that and more tonight on Black Health Now with Doc and Dean.
Black Health Now, your weekly check-in on how your family can get and stay healthy. Joined by experts from around the world, here are Dr. Mike Lenore and Ellis Dean.
Well, you can't have Doc and Dean without the man himself, the past NMA president, as well as your asthma and allergy specialist, also known as Dr. Michael Lenore. Good evening, Dr. Lenore. How are you?
I'm good this evening. How are you? It's getting dark early here out in the Bay Area. It's the best time of year for our weather, so it's a good place to be. I think one of the things that I'm most concerned about, though, is that I think we're still taking this COVID epidemic too leisurely out here. I've been reading, of course, as I'm sure you have as well, about the whole issue of these new variants. The Q1 variant, which is 10% of what we're seeing now. And nobody knows either the implication for its acute problem or for the long haul issues associated with this virus. So I don't see many masks now, see absolutely no social distancing. I think people have just kind of forgotten. Less than 10% of the people in California have gotten that booster. And so consequently, we're in for literally the long haul on both the short haul with COVID and the long haul situations with COVID. So we're still trying to work to encourage people to get vaccinated, especially get your children vaccinated, because almost nobody's doing that.
Yeah, I think people don't recognize, well, we're not a society that's built on building too much for the future. And so when we see, hey, I might have something happen to me later on in life, people aren't worried about that. I think the waters got muddied so much by the political atmosphere. And I don't think we can, put the genie back in the bottle, to be honest with you. We're just going to have to hope there's enough practical people that are getting that updated booster and that are doing what they need to keep themselves and their family members safe, so we won't have an increase in death and hospitalizations.
Yeah, we have 50 years to get rid of polio with a legitimate vaccine. So I think COVID is going to be with us for a very long time.
Yes.
And I think we have to continue to see these surges and the dangers of these variants before people start to really appreciate what the dangers are. So to our audience, we recommend that you wear your mask when it's not inconvenient and you're around a lot of people, and then get vaccinated. Of course, we have that same message we've had for the last couple of years. So I think we got an interesting show today, so I don't want to take too much more time, but let's move into this whole area. I think you have a special issue that the cure for arthritis might be in the grocery basket.
Yeah, it's kind of interesting. We always talk about food as medicine, and that's kind of one of those things, those cliches that go around a lot. But I think we really have to recognize that the foods we eat are either going to help whatever conditions we're facing, or they're going to exacerbate them. And so what we're trying to do is give people some tips and techniques and some things that they can do to help any conditions that they may face. And so we all know as we get older, arthritis comes into play as we age. I know I'm probably going to have some arthritis in my knee. We're going to have some surgery on there. And I know I have a family history of arthritis. And so I'm very concerned about that. So we found these little tips, right? These things that we can do that could help us in terms of treating arthritis on our own with the foods that we eat. So there are 6 things that we can do to improve our chances of either combating or lessening arthritis. Number 1, helpful fats. And so what are those helpful fats? Like those are omega-3 fatty acids. So you can get those in like lentils, or not lentils, but you can get those in like salmon. We we love some salmon. So, and some of y'all pronounce the L, but it's still salmon. Those things, those helpful fats from nuts and things like that will really help. Proteins are the building blocks of a lot of our muscles and things of that nature. And so any kind of clean, lean protein. So lean chicken breast without the skin. If you're going to eat beef, lean beefs, not the fatty like hamburger or really fatty meats, but lean meats, fish, those things will help in terms of your protein. And that's where the lentils come into play as well, because you can get protein. It doesn't always have to come from meat. You can get it from plant-based products. Also, fresh fruits and produce. We know that those are the things that are the best for us in terms of eating that more plant-based diet. So those fresh fruits and produce will really go a long way in terms of staving off or lessening the impacts of arthritis. Fresh spices and herbs. We know this is a good one. This is good for if you have other conditions like high blood pressure and cholesterol, because you can lower the amount of sodium and other things. And fresh herbs and spices can also really interact and give you some vitamins, add flavor to your food, and also lower the impact of arthritis. Frozen vegetables and meat. And you say, wait a minute, we just talked about fresh meats and vegetables. What about frozen? Well, frozen helps you preserve it, because we understand that everybody can't come home and cook every night. But if you have it frozen, you'll still preserve the nutrients in the food for up to 3 months. But you can stretch it out longer and have it when you're available and have time to prepare it. And finally, healthy pantry item. What does that mean? That means, like, instead of white processed rice, you can use brown rice, quinoa, things that you are going to store in your dry pantry that are healthier. That will help your body. You can eat cleaner, live cleaner, and that will help you treat your own arthritis besides just going to the doctor and getting some medication. So those are 6 ways you can treat arthritis right in your own grocery basket. Doc?
Yeah, well, people may think, understand, well, why are these things particularly important? Well, I think you have to realize that arthritis is an inflammatory problem.
Yep.
That means that the body kind of gets itself together and attacks your joints and causes what we call inflammation. And that's what causes the discomfort and the pain. Most of these foods are anti-inflammatory foods.
Yep.
And so consequently, that's what they all have in common as a common denominator. So I think those of you who have arthritis, joint pains, this is the time to take Mr. Dean's advice and look at these items, I think, as therapeutic. You don't just need steroids and Aleve and the other forms of anti-inflammatory agents. If you include some of these anti-inflammatory agents in your diet. So good advice, Mr. Dean. Thank you. One of the things that we have to think about now is I continue to see studies that demonstrate how we in the healthcare system suffer. Black people suffer because we're not treated exactly the same. This week at the African American Wellness Project, with a vigorous discussion of breast cancer. But we didn't discuss it from the what is breast cancer, how is it diagnosed, how is it treated. We looked in depth at why Black women suffer more than other women. And some of the reasons, the main reason, or one of the main reasons from our perspective, is something that might surprise you. Let's hear what Dr. Sharonati and Dr. Kim Rhodes have to say about that.
African American women have a lower rate of getting breast cancer versus our white counterparts. But, and it's a big but, it's only like a 4% difference. And I believe we haven't studied it enough. But what is clear is that we die more. And I am so tired, Dr. Lenore, of saying that everywhere I go in the country. Black women get breast cancer less, but die more. So as women just across the board, we need to take ownership of our health. Number one, mammography remains the gold standard. So you need to talk to your physician or make it your own. Most of us don't even need a prescription or a referral to get a mammogram. And even if you don't have health insurance, every state in this country allows for free mammograms. So 45 to 54-year-olds, if you're in that group, wave your hand. Every year you should be getting a mammogram.
And I am arguing that the whole system is set up to fail for Black people. So, as I mentioned before, and I think back to my aunt who lived in Virginia and had a very advanced tumor at the time that she revealed to the family she had it. So it goes along with the story. You could say, well, you presented too late. But the reality is, for the stage of disease that she had, what she needed was radiation. What the hospital she went to didn't have was radiation. So what
Mm.
she got was chemotherapy,
Mhm.
right?
Mhm.
And so what I'm not saying is, oh, she would have survived had it not been for this horrible hospital. But what I am saying is they didn't have what she needed. And so
Mm.
she didn't get what she needed. And so the way her life ended was not in her own hands and of her own choice. She could have gone home. She could have made plans, right? Instead, she got sick from chemo and ended up passing away from liver failure, even though she didn't have tumors in her liver. So again, I just want to point out that I don't think it's just about implicit bias. I think Dr. Sharon's point about racism is it's racism. Because if you walk it back and you look at where Black people are allowed to get care
Right.
historically, it's where Black doctors were allowed to practice historically. They're funded through largely through federal programs that are fragmented. So Medicaid, right, compared to Medicare, which is really comes from the federal government. Medicaid comes from your state to a large extent, so
Mhm.
may or may not pay for much. Those are the hospitals where the Black doctors historically were allowed to practice. That's where the Black patients went. And in a lot of my studies where we ask a question, why do people go where they go to get their care? We love to say, oh, the social determinants and you don't have a car, so travel distance. Well, we found out that actually travel distance is neutralized if you ask a question about the characteristics of the neighborhood. People in their neighborhood go where they have gone historically to get their care. So we saw people traveling away from and farther away from NCI centers, so the highly specialized centers. We saw them bypassing high volume centers. It's because they had a relationship. That relationship is based on racism. It's based on redlining of where you can live. It's based on where Black doctors could practice. And I can speak for California, can't speak for the rest of the country. But what I will say is that the hospitals in California are still wildly segregated. I can show you several hospitals that have not seen one Black patient for a cancer diagnosis or cancer care in the course of 10 years.
Mhm.
So we're still segregated. And what that means is where you go for care determines what you get. If you're at a safety net hospital, it would be better if you were in a trauma situation because that's what safety net hospitals do really well. But I'm going to go back to my aunt who was in a safety net hospital. There was no radiation machine. She was not going to get radiation. So I think those are the questions that we haven't really, dug into and explored. Last thing I'm going to say is when we look at the trend of disparities over time, what you don't see is Black women suddenly doing really poorly. You see Black women on a steady trajectory of mortality coming down. What you see for white counterparts is mortality suddenly dropping very quickly. So if
Right.
you look at that time point, you need
Right.
to ask yourself, did a new medication come on board? Did a new technology emerge? Because who's getting that new technology? It's not
Mhm.
the Black women, they're still on their trajectory.
All right. Well, thank you very much for, well, interesting perspective, isn't it, Mr. Dean, that we ignored the fact that if you take Black women and you put them in the same systems, they do as well as white women. But for some reason, when they're put in that sieve into the healthcare system, they are somehow treated differently. And that's one of the main reasons the outcomes are not the same. Knowing where to go and knowing what to do and knowing these people who that you're going and doing it with have great experience is really critical in any chronic disease.
Well, I think it's the reason why Black Doctor and the African American Wellness Project exists, because of those disparities, because of the bias that is inherent in the healthcare system. We're working hard every day to get rid of that bias and to close those disparity gaps. But we also have to work on the other side, and that is educating our population so they don't get caught in that system where they know they could do just as well as their white counterparts if that system would remove those barriers and allow them to enter in as anybody would. So you want a colorblind, we want a colorless society. We hear that a lot of times in the political space. It's got to start in healthcare.
No question. I mean, and more and more, I'm just so discouraged by my research over the last several months, because in every chronic disease, Black people, it's how you're treated. It's what the people that you go to with these chronic problems like cancer and diabetes and asthma know about managing the disease. And your doctor, your primary care doctor may be good and you may like him, but he may not be the best resource you need when you have a major problem. And when you select facilities to take care of your problems, you need to know whether, regardless of your income level, you need to know what these facilities have to offer and what their outcome information and data is about a success in treating the problems that you have. In addition, one thing we want to mention here is that whenever you have a chronic problem, you know how bad it is, there are always some clinical trials. Yeah. And hopefully we may be able to post some clinical trials on the African American Wellness Project site. I'm sure you do some on blackdoctor.org. But together we want to keep you in the loop that you need to know what to do when you have a problem and where to go. So we're going to take a quick break, and when we come back, we're going to talk back to Mr. Dean about 6 tips that Black men need to have to keep healthy. I'm Dr. Michael Norm with the Doc and Dean Health News Break of the Day. A study published this week in the journal Circulation finds that when you look at adults with heart failure, white people were twice as likely as Black people to receive a heart transplant or ventricular assist device, a mechanical heart pump often used for patients with end-stage heart failure. This study confirms what's long been known. Black heart failure patients have worse outcomes, and that part of the reason for worse outcomes is that they're not offered the same procedure options. This evidence suggests that heart failure providers are to blame. Workers of color or concern have to make sure those assessing people to get a device or a transplant for heart disease give the same options to Black Americans as to the rest of America. For the latest information on Black Health News, look for Black Health Now with Doc and Dean on Facebook Live, blackdoctor.org, or Facebook Live, the African American Wellness. All right, welcome back to Doc and Dean. Mr. Dean, you have been really you really putting on the job. You look for some of the better articles that come out of blackdoctor.org, and you're going to give us 6 tips to keep Black men healthy, or just men healthy, or Black men and women healthy.
These are 6 things every healthy man knows. And so if you're a Black man in America and you're healthy, if you consider yourself to be a healthy Black man, these are 6 things that every healthy man knows. And so if you're unhealthy, these are some things that you need to know and incorporate in your life, so therefore you can get on that path to being healthy. So number 1, watch your diet. That sounds like a no-brainer, but we have to watch our diet. We have to particularly watch our portion sizes. We know as men, we try to get the biggest plate. We like the big piece of chicken. We worked hard. I know, brothers, we worked hard to get that big piece of chicken. So I'm not telling you not to get it. I'm just saying you got to watch your diet. So if you can get the big piece of chicken, take the skin off, make sure it's lean and it's cooked properly, not fried, but baked or grilled to make it a little bit healthier for you. Number 2, stress less, right? So how do we do that? Well, we've got to find ways to reduce stress at work, reduce stress at home, other ways to reduce stress, because that stress releases that cortisol that can cause that fat to kind of sit around and float around in our body, and that leads to hypertension, inflammation, and heart disease. So we've got to stress less. We got to exercise. Man, we know when we were in our 20s, we could jump out and play pickup basketball game on a whim, not even have to stress, just jump out there and go. But as we get older, our metabolism changes, our body makeup changes. And so we've got to continue to exercise, and our exercise has to change over time. Healthy men know that, and all of us need to know that. Number 4, do not ignore your mental health. Now, we talked about stressing, and so stress is a subset of mental health. But mental health can be a number of things: depression, anxiety. All of these things fall underneath that large umbrella of mental health. We've got to recognize those signs and symptoms before it becomes problematic for us. Number 5, sleep. We do not know how important, we cannot stress any less how important sleep is to our overall healthy routine. An adult male needs about 6 to 8 hours of sleep per night. You need to hit that REM sleep at least 2 cycles per night, and it takes about 3 hours to hit that REM cycle sleep. So that's why you have to get that 6 to 8 of uninterrupted sleep each night. Napping doesn't count. That little cat nap you get at work, whatever, it doesn't count. 6 to 8 hours of uninterrupted sleep every night will really help your body refresh, your brain refresh, so you can tackle each day anew. And finally, this is something that's important for all men. Your sexual health impacts your overall health. So if you are suffering from erectile dysfunction or some other sexual malfunction, you need to get that worked out, because that can impact your mental health. It could cause you to stress, and really that could impact your overall health. So you should have a healthy sex life, however you define a healthy sex life, but you need to incorporate that into an overall healthy regimen. So those are the 6 things every healthy man knows. How many of those lists on that list do you know are you practicing every day? Doc?
Well, you skipped over the most important thing. What are the elements of a healthy sex life? Maybe you can take that. Is that
a willing partner? How about that? That was a willing partner.
That may be an individual thing. We can take up at another time. No, thanks for those health tips. We can't repeat those enough, because you hear them over and over again. We hope that you incorporate them and move them into your own profile. I think these are easy to do, but I think they require a certain amount of commitment, a certain amount of consistency. All right, thank you again, Mr. Dean, and we'll be right back after this break.
How you doing?
I'm good.
You straight?
Yeah, I'm straight. You know what I mean?
You all right, man?
Surviving.
How's life?
Life is it.
How long can you fake it? Real change demands real talk.
Are you okay? No. You know what? I'm not. Can we talk for a second? What's on your mind, bro?
Mental wellness deserves real talk.
Today, it seems like these times go by pretty quickly. We're trying to give people some of the latest news, and I think that we don't have as much time as we would like to have, but we want people to realize that every week we'll be here with a different level of facts, a different level of intuitive insight into some of the health news issues of the day. Right now, we're the only Black health news program online. I know that you didn't realize that, Mr. Dana. I didn't tell you because I don't want the pressure to overcome you too much.
We're just here making sure that we give people information that they can use in their daily lives.
Right, and we want them to come back every week and share our broadcast with other people. We're going to give you news that you can't get any other place on the issues related to Black health. So I want to thank the audience for joining us. Thank Solomon for helping us guide us through this episode of Doc and Dean. We'll always end with the same statement, because health is your biggest asset, so protect it. We'll talk again next week.